New study results show high doses of some ADHD drugs run a higher risk of psychosis.
Here to explain more about this today is our 9 News health expert, Dr. Payal Kohli. Okay, so any ADHD drug or certain types, and then psychosis, this is like hearing things, seeing things, right?
Yes.
Help us with some of the terminology here.
No, this is very concerning and alarming, in fact. So it's ADHD drugs that have amphetamines in them. So if you look at Ritalin, for example, that's not an amphetamine drug. That is not associated with this. Okay. But the ones that do have amphetamines, Vyvanse, Adderall, they can increase your risk of psychosis substantially at the doses that we commonly use. So the medium doses increase your risk about 3.5-fold, and the high doses is 5-fold. And psychosis is mania. It's hearing things, seeing things, hallucinations, frankly acting out, being suspicious, being paranoid, schizophrenic, bipolar. These are all psychotic disorders that can emerge. And the way the study authors actually decided to study this is because these psychiatrists at Harvard, where I trained, were seeing all these young college kids who had no history of mental health problems coming in with psychotic episodes.
Scary stuff.
Yeah.
So these drugs are stimulants. Is that like the cause for this? Like, what's the explanation? You're being stimulated too much? I mean...
Well, so they do stimulate your heart, so they're not good for your heart. So as a cardiologist, I'll say that. But this is really related to dopamine. So the way that they help you focus better, and normally we talk about dopamine as the happy chemical. It makes us do good, right? It helps us focus. It helps with our attention. This is an excess dopamine response in your brain, which is why it's dose dependent. The higher the doses, the more the dopamine floods the brain and actually freaks it out. So think about your neurons actually frying, basically, and they're kind of firing on overdrive, and that creates a psychosis when it happens to an extreme.
I'm thinking of so many adults who take these drugs, but also children. So if you're on one of these drugs, how are you supposed to digest this news?
So you're supposed to take a huge step back, because this is a really important study to shine a spotlight on the fact that prescription of these drugs, not just in young people, but in children, has really skyrocketed over the last few years. We're having more and more diagnoses, and people think they're safe and they perform better on them at work, or their kids have less behavioral issues. But if you look at it, I want you to break it down sort of into 3 things. The first is talk to your doctor about whether you can either come off of it or reduce the dose, because the lowest effective dose is what you need, and this is really a dose-dependent phenomena. The second, if you do have a family history of any kind of depression, bipolar depression, psychosis, schizophrenia, this is a red flag. You may not want to use an amphetamine drug. You may want to use something else like Ritalin if you actually do have ADHD. And the third, do not mix it with other types of psychoactive substances. I'm thinking alcohol and marijuana, because those also are independently associated with risk of psychotic episodes.
And what about if you don't need it? It feels like ADHD is overdiagnosed these days. So if you are taking the drug and you don't necessarily need it for any reason, is that contributing to the psychosis?
Very much so. And so, I mean, the study here tells us that this is an association. So one thing we can't tell from this study are the people who had more likely to get on ADHD drugs also had a predisposition for some psychosis, and we're just kind of seeing it as a marker, or is it actually a causality? Is it an association or a causation? I think it's a causation because it's dose dependent, so that seems to suggest that, but this study doesn't prove that. But regardless, it does really make us question all the adults walking around out there with ADHD diagnoses on Adderall for decades, which we don't know the safety of, really questioning whether we need to de-escalate, and sometimes less is more in medicine.
I'm just thinking of how many kids in college are taking this and then also drinking every weekend. And
right. Or if you have a final exam and you want to focus, sometimes kids take it recreationally, or you have a you have a performance or some important day at work and you want to focus. It gives you that little extra pep in your step. But here really we're talking about frying our brain and frying our heart.
Serious stuff.
That is. All right. Dr. Kohli, thank you. If you want to find more, you always can. Find more with Dr. Kohli at 9news.com/Dr. Kohli.